Hi, everyone. Welcome to the podcast, The Reality of Plastic Surgery. I am Dr. Aftab Siddiqui. I'm a consultant plastic surgeon in Manchester. I'm the host of the show. I started the podcast because I have been working in plastic surgery for a long time, and I wanted to bring a lot of useful information to my patients and the audience, and how these important informations can help you shape what plastic surgery you are looking for, and how to get in-depth information about the real issues before making a plan for plastic surgery. This is the first episode. In today's podcast, I would like to share some information about myself, about my training. So I was born in India. I did my medical school in India and initial training in plastic surgery. Then I came to UK and I got training in big centers in plastic surgery. I did my fellowship in St. Andrew's Center for Plastic Surgery, and I started working as a consultant in Countess of Chester NHS Hospital. My private practice is based in the northwest of England. I've got clinics in Manchester, Chester, and Preston, and I operate in private hospitals in these areas. My practice in NHS is mostly to deal with cancer reconstruction. I deal with trauma reconstruction, hand traumas. I also deal with complex abdominal wall procedures in the NHS. I deal with cancer reconstruction for perineum. I do reconstruction for the lower limb. So NHS practice is quite diverse. In my private practice, most of my patients are cosmetic procedures. I do procedures like abdominoplasty procedures or breast augmentation procedure. People who want to go smaller with the breast, I do breast reduction procedures. Some people need an uplift, which is a mastopexy procedure. I also perform procedures on the face, like somebody is looking for an upper eyelid lift, so that is a blepharoplasty procedure. I do operations on patients who have lost massive weight, like they need surgery to improve the contour of their arms, like an arm lift procedure, or people might need improvement of the appearance of their thighs, which is a thigh lift procedure. In private practice, I also deal with some skin cancer procedures and other smaller lumps and bumps excision. I also offer some non-operative procedures, like people looking for treatment for their wrinkles, which is an injection of the botulinum toxin, or injection of some fillers to make their face more youthful in appearance. And my private practice involves working as a team. So I have a team of people working to provide the service. I've got Rachel working with me. She is medical secretary. She deals with all the patient queries, typing letters, sending out letters, and she deals with all the queries patients have before and after operation. My other colleague is Barbara. She's the main patient coordinator. She also deals with lots of patient queries and organizes patients' clinic consultations and follow-up. The hospital provides all the pre-op assessment for the patients. So everybody going for a surgery will have some pre-op assessment and some investigations. I have got a team of anesthetists who work with me, and Dr. Zafar is the lead anesthetist. So he goes through the papers and medical records of all my patients to make sure all the patients are safe to go ahead and the operations are done in a safe manner. And then all patients are followed up in the dressing clinic, and then I review them in post-op clinics. Plastic surgery is commonly perceived as a cosmetic procedures, and in reality, most of the procedures are designed to improve the appearance of the patients. But some of the procedures are really life-changing procedures, and they improve the patient's confidence and their quality of life, and it really brings a positive change in the patients. I come across a lot of patients who have lost weight, and they were not happy with their appearance and their clothing and the physical issues. And after getting a tummy tuck procedure, they were a different person. They got so confident, their dressing improved, their activities improved, they started taking part in a lot more sports and exercise. So some procedures can be a very life-changing experience for the patients. Some procedures are designed to improve the appearance, and they also help patients to get more confident, and that comes out very well in their life, and they feel more positive and they are more happy with the outcome of the surgery. Some operations are uh, important to change the function, like operations on their hands, and simple operations like carpal tunnel, which improves the symptoms. It improves the hand functions. Some people have trigger finger, and that it can be debilitating, painful, and that improves the hand function. So the procedures can bring about change in their daily activities. There are some procedures like some other skin cancers. The patients had some sun damage in the past and they get cancer. So we do the excision of the cancer and reconstruction. These reconstructions can be simple, like a small skin graft, or we do some reconstruction by moving the skin from the side, which is called a local flap, and they give a aesthetic outcome to the cancer operations. Some other major operations uh, are also life-changing, like somebody has got a huge hernia in the abdomen. So I work with general surgeons to help with those hernia reconstructions, and that improves their pain, their symptoms, and improves their quality of life. Some of the reconstructions I do is like reconstruction of the leg when there has been an injury or there has been loss of a skin. So we do cover with the skin grafts or flaps, and that also improves the quality of the life for these patients. In fact, in some cases, that saves an amputation of the leg. So it can be a very important, a significant operation for these patients.